Hello, my name is Dr. Diwan S. Raja. Today I will discuss about hypothyroidism. I will discuss about the signs symptoms of hypothyroidism, the physiological aspects of hypothyroidism, the etiology and the pathology of hypothyroidism, and the possible laboratory test to diagnose the hypothyroidism, a few differential diagnoses, and the management or treatment of hypothyroidism. So what is hypothyroidism? Hypothyroidism is a condition when the thyroid gland is unable to produce T4 and T3 hormones. Okay, so it is a condition when the thyroid gland is unable to produce adequate amount of T4 and T3 hormones. Where is the thyroid gland? Thyroid gland is located in the anterior aspect of the neck, in front of the trachea and overlapping part of the thyroid cartilage. Okay, so location of the thyroid gland. There's two lobes connected by one isthmus. So this is our thyroid lobe, and this is the another lobe. This is the isthmus of the thyroid gland. This is the trachea. Okay, and if the thyroid gland is unable to produce sufficient amount of thyroid hormones, then we call it hypothyroidism. It may be total lack of formation, maybe inadequate formation of thyroid hormone. Okay, so what are the signs symptoms of hypothyroidism? Signs and symptoms. Signs and symptoms of hypothyroidism. Signs and symptoms. Okay. The patient complains tired all the time. Okay. Lethargy, fatigue, decreased appetite, increased body weight, So patient may complain in this type of complaint patient may give, and we have patient also complains of decreased concentration with poor memory. Okay, so these are the sign symptoms, initial sign symptoms. We'll also get always sleepiness. So excessive sleep. Okay, we got is somnolence, excessive sleep. Okay, we got that. And some people may complain of constipation, sleep apnea, sleep apnea is also a possibility. Okay, and it is mostly seen in the female. Male may also be affected. As the age advances, chances of hypothyroidism also increases. Millions of people in the United States of America is suffering from hypothyroidism. Okay, so in case of female, you may have menstrual irregularities. Okay, menstrual irregularities. Okay, and even excessive menstrual blood, we call it menorrhagia. Menorrhagia. Okay, excessive bleeding during menstruation. Okay, so we have many signs and symptoms. So these are the symptoms. Then if we look at the signs, we look at the sign. Now we have gone through the symptom. So what are the signs of hypothyroidism? We'll get bradycardia. Bradycardia, that means decrease in pulse rate less than 60, pulse less than 60 beat per minute. Okay, so we'll get also hypothermia. Temperature may be 1 degree Fahrenheit, even more, less than normal temperature. So we'll get bradycardia, we'll get hypothermia. Okay, and distant heart sound. Okay, because a lot of hypothyroid patient also suffers from pericardial effusion, so heart sound may not be auscultated properly. Okay, if you look at the hair, we get coarse and brittle hair. Okay, hair is coarse and brittle, so we'll get that. And if you use our hammer to look at the deep tendon reflex, then increase relaxation time for deep tendon reflexes. Okay, we got that. A lot of the patient also complain constipation is a problem, menstruation is a problem, but these are the signs. You'll get bradycardia, hypothermia, temperature may be low, and skin is also dry skin because lack of sweating and lack of blood flow to the periphery because of sympathetic disturbances, sympathetic innervation disturbances. We may get dry skin. Okay, we got that. So just if we look at this picture, at this funny picture, we look at that. So there will be loss of hair. There will be loss of hair from the outer 1/3 of the eyebrow. So loss of hair from outer part of the eyebrow. Okay, this hair will be coarse. So coarse hair. Okay, and if you open the mouth, you may get macroglossia. That means enlarged tongue. Okay, that may lead to sleep apnea sometimes. The lip may be swelled up, lip. There may be collection of fluid around the eye. Okay, so we got that picture. And this person has poor mentation, poor mentation, poor concentration, poor concentration. Okay, and the patient's intellectual capability will be retarded. Okay, so, and also they complain of poor memory. Poor memory is very common. Okay, sometimes people may confuse with that of the Alzheimer's disease. Okay, we got that. So if we go to look at the extremity, then muscular weakness, that is a common feature. Lack of energy, tired very quickly. Okay, in female, along with menorrhagia, there may be pictures from the breast. Okay, so menorrhagia, excessive menstruation, there may be even amenorrhea, irregular menstruation, and there may be milky discharge from the breast, milky discharge from the breast. Okay, we call it galactorrhea, that is a possibility. Okay, so menorrhagia, excessive menstrual blood, milky discharge from the breast, galactorrhea is a possibility, and a lot of them suffer from depression. Okay, so if you assess their serum cholesterol level, high serum cholesterol level, okay, so high serum cholesterol level. Why there is high serum cholesterol level in a patient of hypothyroidism? It is due to decreased metabolism or altered metabolism of the lipid and cholesterol by the liver, and there is decreased excretion of cholesterol along the bile. So there will be excess chance to get atherosclerosis. Even some of the patients of hypothyroidism may have hypertension, high blood pressure. Okay, cardiac output is less, but there is atherosclerosis. Excessive peripheral resistance may even lead to death. Okay, so just we'll go through that, this image here. So always sleepy all the time, poor concentration, forgetfulness, lack of energy, lethargy always, and there may be pericardial effusion, chance of pericardial effusion. Okay, even there may be chance of pleural effusion. This happens due to lack of albumin. There will be decreased plasma colloid osmotic pressure, so there will be excessive capillary leakage to the serous spaces that may lead to pericardial effusion. Intestine, what happened? Constipation. Why constipation? Because of decreased motility of the intestine, because of decreased peristalsis of the intestine. Okay, we got that. And deep tendon reflex, as I discussed previously, there will be increased relaxation time. Okay, so will get menorrhagia in the reproductive system. Okay, these are the features of hypothyroidism. Okay, differential diagnosis, anything like that of differential diagnosis, differential diagnosis. We have depression, dementia, nephrotic syndrome. Okay, depression due to any reason, dementia, nephrotic syndrome. Okay, so that may happen. We may get many other differential diagnoses. It may look like congestive heart failure, congestive heart failure. So these are the differential diagnosis of hypothyroidism. We may add long list. Okay, now we'll go to the causes of hypothyroidism. What are the causes? Okay, what are the causes of hypothyroidism? Okay, the thyroid gland may not develop, so we may get congenital hypothyroidism, congenital hypothyroidism, thyroidism. It is also called cretinism, cretinism. Okay, the baby born with a defective thyroid, it may be totally absent, may be non-functional. So initial few weeks there may not be any problem. Then the milestone of development will be retarded. So there will be decreased growth of the skeleton. Okay, skeleton, but the soft tissue growth will be marked. Increased soft tissue growth, increased soft tissue growth, increased tongue size, increased tongue size. Okay, pot belly, abdomen looks like a pot belly appearance, and low IQ. Thyroid gland is very important for the development of the brain, especially for the neurons myelination. Okay, so if the thyroid gland is not secreting sufficient amount of hormone, the neuron will not be myelinated, so the infant will suffer from permanent brain damage due to lack of myelination. Okay, and there will be short stature infant due to cretinism, so we'll get short stature. Okay, so decreased growth of the skeleton, increased soft tissue growth, increased tongue size, that is macroglossia, pot belly appearance. Okay, that is called congenital hypothyroidism or cretinism. Okay, if the hypothyroidism that occurs after childhood, we call it myxedema. That is hypothyroidism after childhood. Okay, so that is myxedema. Okay, we get that, and we get in hypothyroidism, one of the signs is non-pitting edema. Non-pitting edema. Idea is that there will be a collection of fluid in the interstitial tissue space, like a jelly-like collection that is rich in chondroitin sulfate and hyaluronic acid plus protein. So there will be non-pitting edema. If you push, you may not make a depression because of the collection of chondroitin sulfate, protein and hyaluronic acid. Okay, so that is myxedema. It may be found also in kidneyism. Okay, so we got myxedema. What is the cause of myxedema or hypothyroidism? Actually, go there. There may be multiple reasons. Most important reason of hypothyroidism in the United States and also the developed country is Hashimoto's thyroiditis. Hashimoto's thyroiditis. This is in the developed countries. Okay. In the developing country or poor country, where especially where the salt is not fortified with iodine, okay, we'll get iodine deficiency hypothyroidism. Iodine deficiency hypothyroidism. Okay, this is due to the lack of iodine. Okay, hypothyroidism may be due to surgery like thyroidectomy. Okay, that is possible. After thyroidectomy, we may have hypothyroidism, or radiation due to any region that may damage the thyroid cell. We may have hypothyroidism. Okay, or someone is taking anti-thyroid drug, excessive anti-thyroid drug, that may also lead to hypothyroidism, like propylthiouracil, carbimazole. Okay, or someone is getting some type of other drug like that of anti-bipolar drug, like that of lithium, or some patient is taking some type of anti-arrhythmic drug in your serum, may also cause hypothyroidism. So there are many reasons for hypothyroidism due to deficient production of T3, T4 from the thyroid gland. This is called primary hypothyroidism. These are primary. Okay, primary causes. Hypothyroidism due to secondary causes. Okay, secondary causes when there is damage to the anterior pituitary gland. Okay, destruction of the anterior pituitary gland, okay, due to any reason, due to surgery, like a person has anterior pituitary tumor, surgeon may take out the anterior pituitary, or it may be a complication of excessive bleeding after delivery of the baby. We call it postpartum hemorrhage. So we may have destruction of the pituitary gland, and that may lead to hypothyroidism, because pituitary gland is a source of thyroid stimulating hormone that will stimulate the thyroid follicular cell to produce T4, T3. So if the pituitary gland is not working or it is damaged, then we will have hypothyroidism. Okay, so these are the causes of secondary hypothyroidism. It may be due to stroke, or trauma, any type of trauma, to the hypothalamus. Okay, so that may cause decrease in the thyrotropin releasing factor from the hypothalamus. That is very essential to stimulate the anterior pituitary to produce thyroid stimulating hormone that will help in the secretion of the T3, T4 from the thyroid gland. So hypothalamus, this is pituitary, this is hypothalamus. If they are not functioning, we may have hypothyroidism. We call it secondary hypothyroidism. Okay, so we got the types of hypothyroidism and causes of hypothyroidism. Okay, now we'll go to the lab test. How to diagnose hypothyroidism? Lab test. We'll give emphasis on T3, we'll assess the T4 level in the blood, free T4 level. We'll also assess the TSH level. Okay, so these two are important determinant for the diagnosis of the hypothyroidism. If it is less, usually in hypothyroidism, T4 is less and TSH is high, except in case of pituitary destruction or hypothalamic destruction. The usual picture, T4 is less, TSH is high. Okay, we also look for some antibody because Hashimoto's thyroid is an important cause of hypothyroidism. Most of the hypothyroidism is due to autoimmune mechanism. We also look for the anti-microsomal antibody titer, also anti-thyroglobulin antibody titer. Okay, we look for the anti-macrosomal antibody titer, anti-thyroglobulin antibody titer. Usually this is high in case of autoimmune cause. That is the most important cause of hypothyroidism. Okay, so we got the test for that. So there are many mechanisms to get hypothyroidism. One of them is the lacking of iodine. There may be defective iodide pump. There may not be conversion of iodide to iodine. There may not be synthesis of monoiodotyrosine, diiodotyrosine, triiodothyronine, and thyroxine by the addition of iodine to the tyrosine molecule. Okay, there may be some problem. There may be something wrong in coupling of the two diiodotyrosines, and we may not recover the iodine from monoiodotyrosine or diiodotyrosine due to lack of some hormones. Okay, there are many mechanisms associated with iodine deficiency hypothyroidism. Okay, now we go to the treatment of hypothyroidism. Treatment is very easy. Okay, treatment. What is our problem in hypothyroidism? Our patient is lacking thyroid hormone, so we'll give that patient the replacement therapy. So we'll give levothyroxine. That is a synthetic T4. It will be converted into T3 in the body. Okay, so it will T4 will be from T4 will get T3, T3 is the more potent form of thyroid hormone. Okay, this is the most abundant form of thyroid hormone. Okay, we'll give that person this. Okay, so we got T3 from T4. T4 means thyroxine, T3 means triiodothyronine, the most potent form. Usually it is given in the empty stomach once daily, and we will increase the doses of levothyroxine according to the improvement of the signs and symptoms, plus our determinant is TSH. Okay, assessment. That is very essential. It should be done almost every month initially to assess TSH so that we can adjust the dose of the levothyroxine. Levothyroxine is a thyroid hormone. If it is given too much dose, we'll get the features of thyrotoxicosis. Okay, so two interesting topic here in associated with hypothyroidism. One is galactorrhea, that is discharge from the breast that may happen, that may be associated with thyrotropin releasing factor from the hypothalamus that not only stimulate the thyroid stimulating hormone from the anterior pituitary but also stimulate the prolactin cells. Okay, that may happen. We may have also carpal tunnel syndrome because under the flexor retinaculum we may have collection of the chondroitin hyaluronic acid protein rich fluid that may compress the median nerve, that may lead to carpal tunnel syndrome in some individuals with hypothyroidism. Okay, so that's all for today. If you like my video, please subscribe my channel and hit the button, share information with your friends, and certainly please pass any comment. I will address those comments. Have a nice day. Bye now. Thank you.